Hello, our dear viewers, and welcome to a new edition of our program Africa Today. In today's edition, we are going to shed light about the cooperation among the different African states in order to face the challenges and the repercussions of COVID-19. But first, we'll start with this report where Cairo and Washington discussed developments over the Grand Ethiopian Renaissance Dam on Tuesday. The talks in Cairo also discussed several regional issues of mutual concern. More in the following story.
Developments on the Grand Ethiopian Renaissance Dam topped the agenda of talks on Tuesday as Cairo received U.S. Treasury Secretary Steven Mnuchin. Officials said that during the talks, Sisi expressed his appreciation for efforts by U.S. President Trump in the GERD issue, as well as the personal involvement of Mnuchin in the successive rounds of negotiations held in Washington last year. According to a statement by the U.S. Embassy in Cairo, Mnuchin said that his trip to Egypt and Sudan, which is next on his Mideast tour, accentuates the need to equitably resolve the outstanding points of disagreement and forge a binding agreement on the GERD that addresses Egypt's concerns and those of other parties. Sisi and Mnuchin also discussed several regional issues in the meeting, including the latest developments in the Palestinian issue and ways to revive the peace process. They also discussed the latest developments in bilateral ties. Mnuchin is currently on a Middle East tour that includes Egypt, the Israelis, the UAE, Sudan, and Qatar.
And meanwhile, tens of thousands of refugees have crossed the border from Ethiopia to Sudan, fleeing conflict in Ethiopia and Tigray region. The UN is relocating them to new region in Sudan. More details in the following story by Samah Sharif.
The UN Refugee Agency UNHCR said on Tuesday that a second refugee camp has opened in Sudan for people fleeing violence in Ethiopia's Tigray region, carrying little more than the clothes on their backs. Nearly 600 people have been taken to Tunaidba camp in Sudan's Gedaref state, according to the UN Refugee Agency, after nearly 2 months of ongoing conflict across the border in Ethiopia between federal government troops and the Tigray People's Liberation Front (TPLF). The UNHCR spokesperson said that it was impossible to gauge the level of fighting in northern Ethiopia amid continuing access restrictions. Speaking to journalists in Geneva during a regular briefing, he said that those who had reached Sudan from Tigray told UN humanitarians that they had traveled for days. He said the latest arrivals tell of being caught in the conflict and being victims of various armed groups facing perilous situations. The UN agency continues to register new refugee arrivals at the Sudanese-Ethiopian border, where around 800 people have crossed into eastern Sudan so far this year. The UNHCR says that since early November, more than 56,000 Ethiopian refugees have fled the country.
The number of confirmed COVID-19 cases in African continent has reached 2,830,462 as of Monday. The figures was reported by the African Centers for Disease Control and Prevention, Africa CDC. More details in the following story.
The Africa CDC, a specialized healthcare agency of the African Union Commission, said that a total of 2,830,462 cases of COVID-19 have been confirmed till last Monday. It said 2,343,850 people infected with COVID-19 had recovered from the infectious virus across the continent so far. The Continental Disease Control and Prevention Agency said in a statement that the death toll from the ongoing COVID-19 pandemic has reached 67,246 as of Monday afternoon. The CDC showed that the most affected African countries in terms of the number of positive cases include South Africa, Morocco, Tunisia, Egypt, and Ethiopia, respectively. South Africa has the highest number of confirmed positive COVID-19 cases at 1,100,748. The country also has the highest COVID-19 inflicted deaths at 29,577, according to the Africa CDC. Morocco comes next with 443,146 confirmed COVID-19 cases and 7,485 deaths, followed by Tunisia with 143,544 confirmed cases and 4,800 COVID-19 related deaths.
And to shed more light about the cooperation among the different African states in order to face the repercussions of COVID-19, we are very much delighted to have with us over the phone Dr. Salah Abdallah, our health expert. Dr. Abdallah, good afternoon to you.
Good afternoon. Welcome.
Welcome, sir. Dr. Abdallah, what are your expectations for the cooperation among the different African states amid COVID-19 in 2021?
Well, of course, the African countries have experience from the first attack, and of course, cooperation between the different African countries will help in controlling or diminishing the side effects or the bad effects of COVID-19. The cooperation will be in many sides. Number one, on the scientific side, there will be a change of information about the spread of the disease, the number of cases in each country. If there is any researches will be done within the African countries, in the universities or in the research centers, I think there will be a cooperation between these centers. This is from the scientific side. From the social side, you know, there is some Africans are poor and they are need support from the other African countries for the some of the tools which be used in the resistance of the disease, like alcohol, like other medical equipment and so on. And I think the cooperation here will be higher. Countries like Egypt and South Africa and Nigeria can help other countries which have no facilities. Besides, of course, the help of the United Nations or the UNICEF and the rich countries in Europe.
Yes, indeed. Dr. Abdallah, how do you expect the African states to decide over the lockdown measures?
Well, the African states, of course, as I said before, and I will continue to say it, is more lucky than Europe and other countries, because the number, although there is a high number of cases, but is less than the other European countries, and the difference is too much. That's why you will find that the lockdown in African countries will not be complete. You know, they can lock down the schools, the universities, some of the cafes, some of the places which can collect a great number of people, but the life will go as usual, especially in the economic side. And this is for the benefit of the African countries. You know, African countries is poor and they can't pay for the citizen loans or gifts to live. You know, the poor economy in Africa means that they have to work every day to live. That's why complete shutdown is dangerous to Africa. It's not in the benefit of Africa. But looking down the places which have great number of persons, this can be more benefit to the African countries. And if we observe from the number of the disease, you will find that the tourist countries in Africa having the highest number of the infections.
Yes.
As example, South Africa, Morocco, Tunisia, then Egypt. You know, these countries are connected to Europe more than the other African countries.
Yes.
And these countries they have more tourists than other countries. That's why you find the number of infections are a bit higher than the African countries in the center of Africa.
Yes.
But anyhow, generally, the case in Africa is not dangerous to the extent that which will make people afraid too much. is still within control, and still the number is much less than one European country.
Yes. Dr. Abdullah, how can the different African nations cooperate and coordinate to avoid harsh economic repercussion of coronavirus lockdown measures?
Well, the number one, they have to be within the countries which will use the vaccines. The vaccines now will start in the whole world.
Yes.
So the African countries must be part of that vaccination because it's not necessary to vaccinate all the people, but as much as you can vaccinate people, you will decrease the number of infections. This is number one. Number two, the African countries must be strict in the isolation of the cases, either house isolation or hospital isolation, according to the equipment and according to the standard of health in each country. Thirdly, the people must use the masks in every place, in the markets, in the streets, in the general transportation. This is very important. The mask is the protection number one against that disease. Of course, the African countries must prevent all the parties, the kind of parties which can collect a great number of people, whether religious parties or religious ceremonies or football matches or weddings and so on and so on. This is serious and they must control that perfectly. I think if this happens within 2 months, which is January and February, the number of cases will be decreased, and from May on, the cases will be very less and less dangerous, and we will pass this conflict, and the vaccines will be more available, so the cases will be much better.
Indeed. Dr. Abdullah, experts report said that there is a prediction that the emerging market economies would witness drop in the outflows till mid-2021. What's your take on that?
Can you repeat this question, please, because I don't hear it well?
Yes. Experts report had predicted that the emerging markets would witness a drop in outflows till mid-2021. What's your take on that?
Of course, this will happen because of many reasons. The economic power of the countries will be less. The exportation and the importation will be decreased. The number of cases will be increased, and this will affecting many activities like tourist activities and so on. So the condition will be like that. From the middle of 21, cases will be less. The disease will be controlled. The vaccination will be increased. And I think the traveling from one country to another, by that time, we need a vaccination card. And this will reflect itself on the economy. The traveling will increase, the tourists will increase, the importation and the exportation will increase. So there will be change within the middle of the 21. That's true.
Yes. Dr. Abdullah, how can the African countries cooperate to overcome the decline here in the performance of the economy due to the repercussions of COVID-19?
Well, the African countries, of course, will suffer because, as I said, the tourists will decrease and the number of and the exportation and importation will be decreased also. Some of the projects, big projects, may close. That's why, African countries, which is a bit richer, have to give aid and loans to other countries which is suffering. At the same time, I think there must be a kind of inter-African trading, you know, trading through exchange of materials, not depending on the dollars and the sterling and the currency. I think if this happens, it will decrease to much extent the economic effect or the worst economic effect on the African countries, especially on the poor people. You know, most of the African countries, the poor people is up to 70% of the population, and they depend on from hand to mouth, daily work. So, of course, this will suffer too much. And as I said, by loans or by aid from other African countries, can poor countries to a great extent control that matter. And by a kind of trading which we call exchange trading or inter-African trading, this may help in decreasing the effect of COVID-19 on the economy.
Hope so. Dr. Salah Abdallah, our health and economic expert. Many thanks for watching or for being with us and for your precious input. And our dear viewers, with that we come to the end of this edition of Africa Today. Hope you have enjoyed it. Until tomorrow with another crew, it's goodbye. Thank you for watching.